Hi, it's Dr. Hudak. I'm going to talk today a little bit about cataracts, which is something that almost all of us deal with as we age. It's mostly because it's due to sunlight coming through our eyes, cooking the lens proteins, similar to egg whites turning white and stiff when you apply heat radiation. The lens, which is made of protein, when the sunlight strikes, it turns stiff and opaque, and that's what a cataract is. Now, just so you know, the lens of our eye sits behind the cornea, the window shield of our eye, some fluid in there behind the cornea, the iris, which is the colored part of the eye, and then the lens sits right behind that colored part and is almost the same size as the colored part. As it becomes a cataract, we tend to name them for the area or location where most of the opacification is occurring, most of the cloudiness. If it's in the center, we refer to it as a nuclear sclerotic cataract. If it's more out in the peripheral portions of the lens, we call it a cortical cataract. And if it's smack dab in the center on the back side, where there is a membranous capsule around the lens, we call it a posterior subcapsular cataract. All of these cataracts are curable with surgery. Insurance generally will not pay for the removal of the cataract until it gets to a point that no matter what we do with glasses, the person would still not see 20/40 line, which is the line they have to read properly in order to pass a driver's license test. For many people, this means they go for 5, 10, 15, 20 years with cataracts growing where they're having symptoms until it gets bad enough that insurance will pay. But then they will, and at that point, the lens is removed and an implant is put in, which will never become a cataract and allows the person to see very, very well once again like they did when they were youthful. The only thing that could be limiting this would be diseases of the cornea that cause scarring, which most people don't have, but some people, especially those who had an injury to the eye, have, or something far more common of the retina, like macular degeneration. We will talk about macular degeneration, diabetic retinopathy, and other disorders, as well as glaucoma in some other videos. Have a great day.